Welcome to this module on information systems within the topic of health informatics and applications. Healthcare informatics covers many aspects of health information technology, or HIT. On a technology level, the Health IT department of an organization oversees the electronic health record, other information systems, connectivity to the systems, security, privacy, personal devices, and other areas essential to conducting the business of healthcare. On another level, Health IT directly impacts the health of individual people and populations, the quality of care provided to these people, and the cost of that care. Health IT works together with providers to ensure safe, effective, patient-centered, timely, efficient, and equitable health care. It's important to keep this in mind as you begin your study of health informatics. The development of health IT started in individual hospitals before the Institute of Medicine report in 1991. The second report, To Err is Human, made people aware of the number of deaths that occur each year due to medical errors. President Bush's executive order in 2004 established the Office of the National Coordinator for Health Information Technology, or ONC. However, the office lacked the funding to carry out the mandates of providing an electronic health record for every American. During this time, the Centers for Medicare and Medicaid Services, or CMS, was changing their reimbursement practices from fee-for-service to pay-for-performance. They were looking into new ways to create alternative payment methods that would reward quality of care rather than the number of visits or procedures you received. There were major changes when the Health Information Technology for Education and Clinical Health, or HITECH Act, within the Stimulus Act, which is also called the American Recovery and Reinvestment Act, of 2009 set aside money for providers and healthcare organizations who adopted electronic health records and showed that they could meaningfully use the EHR. The HITECH Act also gave ONC the authority to certify EHRs and set standards for exchanging data through the Health IT Standards Committee. The ONC has also created beacon programs to show how health IT can be used in communities, and the regional extension centers to help small provider offices successfully implement an EHR. The ONC continues to influence healthcare IT through the Federal Health IT Goals and the Federal Health IT Strategic Plan for 2015 to 2020. Information systems themselves have a history that is separate from the legislative and funding history. The turning point was the introduction of the personal computer in the 1980s and the Medicare DRG payment system that depended on the patient's diagnosis and procedure for payment. During the 1990s, vendors focused on creating best-of-breed systems where each department, lab, radiology, pharmacy would buy the best product for their use. Another turning point came when the 2000 IOM report on medical errors, because the priority became healthcare quality and safety, care and coordination, and engaging patients in their care, along with communication among the systems. The two main types of systems are administrative information systems and clinical information systems. Administrative systems are similar to other business information systems, such as accounts receivable and billing, materials management, human resources management systems. Under this category would be the revenue cycle management systems that include the coding system and the reporting to external agencies. The clinical information systems are used by providers to diagnose and treat patients. These include laboratory, radiology, and pharmacy systems, along with the EHR. The EHR is typically made up of several applications, such as medication administration, clinical decision support, computerized provider order entry, documentation, and patient tracking systems. A patient portal is often managed by the primary care provider to give clients access to some of their appointments, medications, and test results. The systems are becoming increasingly more complex as telehealth applications, remote monitoring of devices, and use of data from mobile applications are added to the system. On top of all of this is the master patient index that must maintain accurate synchronization of each patient's records across multiple systems. So what are some of the key issues and challenges within these systems? The first one is interoperability, or the ability to exchange electronic health information with another system. This is one of the major foci of the ONC and has led to the implementation of health information exchanges in many states. Another issue is usability of the systems. Clinicians are often frustrated with the lack of consistency and intuitivity in some systems. System usability plays a major role in caregiver burden. Another issue is health IT safety. There are often unintended consequences of some system designs which create problems and errors after implementation. Another area is the increasing burden of measuring outcomes to show improvement in patient care, and the cost and intricacy of ensuring appropriate privacy and security. There are many players in the field of healthcare informatics. Take some time to get to know who is involved. As in every other business field, there are vendors and product suppliers. Through mergers and acquisitions, these suppliers can change frequently. Then there are professional organizations for providers and business leaders, such as HIMSS and AMIA. There are many large and small healthcare organizations along with health plans. There are also the governmental agencies such as CMS and ONC that I've talked about, as well as the VA and DoD. Finally, one of the newer players are the companies that offer data analytics services. Some of these firms offer data analytics to other areas of business also. Thank you.